Hello and welcome to Horizon Virtual. I'm Tim Schmidt and I would like to take just a brief moment to introduce you to Dr. Todd Severnak and Dr. Darren Willardson. They are the co-founders of Horizon Virtual. Horizon Virtual is a virtual medicine provider. What does that mean? We provide bedside services, virtual telehospitalists to critical access hospitals that are in need of staffing. And we partner with these hospitals to bring quality service and to keep patients in your hospitals longer. There's nothing worse than transferring a patient that we should be able to take care of at our hospital because it's lost revenue. Well, I want to introduce you to them via video. In this video, I want you to take notice of what other CEOs are saying about Horizon Virtual. I also want you to take notice of what the nursing staff says about us. And I also want you to notice as well how virtual telehospitalists interact with your staff. And also take notice how they can interact with the entire room around them. There's really very little that they're limited to doing. So take notice of this, and if you are looking for virtual hospitalists, or if you're looking for virtual medicine within your critical access hospital, I would invite you to take a look at this video and then reach out to us and connect with us. You can also find out more at horizonvirtual.net. Enjoy.
We have had issues with physician recruitment and retention. A lot of that comes into play when you're in a rural community that you're covering the ER, you're covering a clinic practice, you're covering OB, you're covering hospital. In order for us to make this more of an attractive environment for physicians and providers to practice, we needed to find how we can work on a work-life balance that meets the needs of these new physicians coming out of training.
I live in St. Cloud and I work in St. Cloud at CentraCare Hospital as a hospitalist. I also work at the company Horizon Virtual, where we take care of hospitalized patients virtually. Many times we'd go up to small town hospitals, critical access hospitals, and we'd cover them in person. We'd have one hospital covered by one internal medicine doc. And it was great. You get to go up and meet different people and see different hospitals. But many times we'd go up there and find that we'd have probably one admit and 3 or 4 cross covers a night, page calls, and that would be all you'd have, and you'd be there for 12 hours. So you'd have a semi-scarce resource covering one hospital. And so we said, well, I think we can do this better. And so we said, if we were there virtually at 4 or 5 hospitals, you could cover them at the same time.
And that's where the idea kind of came from, where we could more efficiently bring physician time to a small town hospital. It allows the breaks for the physicians there, and where one person can cover 1, 2, 3, 4 hospitals. And it is an outstanding way to improve efficiencies in healthcare.
With the telehealth cart, it has digital equipment on it that we can listen to the heartbeat. We put on headphones and we can hear the heart tones. We can see in their eyes, we can see in their ears. It's got stethoscope, otoscope, and ophthalmoscope all built into it.
They're super wonderful with the patients. Some of the older population look at them and go, what is this? But they're receptive, and I think once they get through the process, and the doctors, like I said, are so personable with them on the television screen that once it's done, they're like, yeah, that worked very well.
The staff have really embraced it. The nurses have really embraced it, which is great because they are now taking care of higher level acuity patients, and our physicians have that work-life balance. They know at 7 p.m. they can go home, they can shut their phone off, and they have somebody at the other end that is covering the inpatient portion of the medical practice. It also has allowed us to enhance the services that we provide to our community, which from administration to the medical staff is the most important thing, is making sure that we're taking care of our community. And this has allowed us with a solution that provides us the highest level of care in a rural critical access hospital that you would get at a large tertiary hospital such as St. Cloud Hospital.
The support, the personal touch that you get here in a local hospital is very beneficial for healing and caring. And so patients love the fact that they don't have to be transferred 70 miles away from their home to get their health care.
Who would have ever thought that you could come in and be treated by a physician for an inpatient stay that could last up to 3 days and come out and your results are just as good, if not better, than if you were in a large tertiary center.
We hope to be able to continue and to provide world-class care to patients in their home hospital. I mean, that's really at the end of the day what it's about, is to get care that is as good as any place you can get in the world.